thank you so much for being here today, taking the time out of your day as we take a deeper dive into all things HIPAA. So that being the HIPAA compliance framework with a focus, of course, from a cybersecurity lens. Okay, so first up, an introduction for Matt Lewis, who is our Chief Security Officer here at Field Effect. Matt joined Field Effect after a 20-year run at the government working at CSE and the Canadian Centre for Cybersecurity. And throughout his career, he's focused on IT strategies, security operations, data analysis, incident response, pretty much anything you can think of when it comes to cybersecurity. So here at Field Effect as our CSO, he oversees all aspects of our physical and information security, along with our compliance programs. So without further ado, over to you, Matt.
So welcome everybody to our webinar today about HIPAA. We only have a half an hour. We have a lot of information to go through. So let's start with our agenda. First off, I'm going to talk a little bit about HIPAA, its history, how it's evolved over time, who it applies to. Then we're going to go through some of the requirements, the HIPAA safeguards. We'll talk about the challenges that HIPAA can pose to implementers, and then we'll pivot over to how Field Effect and a really good MDR service can help with HIPAA implementation. Then we'll throw it back over to you for any questions and answers you have. Just a note about our presentation. We are only going to give you just a quick intro to HIPAA. There are many multi-week courses out there that go through all of the subtleties and nuances of the legislation. And because we only have a half an hour, we're going to be going through it pretty quickly, but I'm confident that every attendee today is going to get something out of this and that you're going to come away with a little bit better understanding of the legislation and how Field Effect and our service can help. So about HIPAA, it was introduced in 1996. It has a birthday coming up in August. Happy 28th birthday, HIPAA. Since then, it has had regular updates, and we're going to be going through those in an upcoming slide. But the overarching goal of the legislation has not changed since the mid-90s. Legislators at the time, they were looking to improve the portability and the transferability of insurance. They were looking to reduce waste and fraud, and they were hoping to improve the security of patient health information, or PHI. So what is PHI? You can think of that as any medical record that can be traced back to a person through one of 18 specific identifiers. Now, those identifiers range from your name, your address, your social security number, your phone number, and they now even include biometrics like a fingerprint or a full face photo. If that patient health record has any one of those 18 identifiers, it's PHI, and it's critical to safeguard under the legislation. If it's completely anonymized, like they sometimes do for drug trials and things like that, it can be shared more easily and more widely. You might also hear the acronym ePHI. ePHI is just an electronic version of PHI. So you could think of your printer as that magical box where ePHI becomes PHI, where the electronic becomes physical. So who does HIPAA apply to? Now, the legislation calls out two major buckets of entities that have to comply with HIPAA. The first one is covered entities. Covered entity is somebody who produces, uses, or transmits PHI during the course of their operations. So you're mostly thinking healthcare providers there, and that's true. Everybody from a single doctor health clinic up to a major hospital, they are considered a covered entity. But also insurance companies are covered entities, as well as healthcare clearinghouses that store and transmit a lot of that patient health information. The second one are business associates. A business associate is somebody who doesn't interact with PHI during the normal course of their duties, but they're a contractor or a subcontractor for a covered entity. It could be a law firm, it could be an accounting firm, but I think the most pertinent example for our crowd today will be managed service providers, the companies that handle the IT for covered entities. MSPs are certainly business associates. So who does HIPAA not apply to? First one, kind of a hypothetical here, cash-only doctors. If you ever come across a physician or somebody who's denying any type of electronic or insurance payment, it could be that they're doing that not only to save on taxes, but to make the argument that they don't engage in any of the type of transactions that are covered under the HIPAA legislation. Would that work? I'm not sure, but I'll leave it to the lawyers and HHS to figure that one out. The second one was non-humans. So sorry for any pet owners. Rover is not covered under HIPAA, but many states are implementing legislation that specifically protects the health records of pets. So if you're an MSP out there and you handle veterinary clinics, a lot of what we're going to be talking about in the upcoming slides could apply to you one day. This is just to give you an idea of how the technology landscape has changed since 1996 and why it was necessary for the HIPAA legislation to evolve. So if you were using a computer back then, it was likely running Windows 95 with a high-end Pentium processor. If you were transmitting PHI from one computer to the next, the floppy disks might have looked something like this. And if you were using that new thing called the internet, you were likely connecting to it on this lightning quick 56K fax modem from US Robotics. Remember those? And lastly, obviously the cloud didn't exist at all. And if you had told anybody that you were storing patient health records in the cloud, they definitely would have looked at you a little bit funny. So major changes were necessary across the years. So let's go through those. The first one occurred in 2003 with the implementation of the privacy and the security rule. That is not to say that the 1996 legislation didn't include any wording on privacy and security. It did, but it was much more general. 2003 is when they started calling out specific safeguards that they expected covered entities and business associates to comply with. 2006 was the enforcement final rule. This gave the Office of Civil Rights, which is the bureau under HHS that deals with enforcement of HIPAA, it gave them a bigger stick. Before 2006, the fines were capped at a very low amount and they were relatively small. And from that point on, there was a tiered enforcement structure with much stiffer penalties for noncompliance. In 2009, we had the addition of the HITECH Act. The big change here was breach notifications. Prior to 2009, a covered entity or a business associate that had a breach of PHI was not obligated to inform anybody. Starting in 2009, they had to inform not only the person that was impacted by the breach, but they had to inform HHS and in some cases the media as well. Right now, the rules state that for a breach involving the records of 500 individuals or more, the notification to HHS has to be almost immediate. For smaller breaches, there's a longer window there. And in 2013, we had something that was called the Omnibus Final Rule. This gave patients more power to request their PHI from providers, but the big impact here was for business associates. Starting in 2013, business associates had direct liability as well as covered entities for HIPAA breaches. So this had a big impact on managed service providers and other business associates, and they really had to start upping their game. Here are the HIPAA safeguards. And they're broken in the legislation into three major buckets: administrative, physical, and technical. Now, you might think that physical and technical are the big ones, but it's really a lot of administration. Most of HIPAA and what they call for is bureaucracy. So the administrative controls are all about making sure you have the correct policies and procedures, that they're updated regularly, that you have what are called business associate agreements with all your business associates that spells out your roles and responsibilities and your obligations. It also includes things like doing regular risk reviews of your IT systems and the risks to PHI on them. Physical controls, those are really what you expect. They're making sure that you have a clean desk policy, that PHI and documents like that aren't sitting all around, that you have things like cable locks on the machines so they can't grow legs and walk away. Maybe that your servers aren't sitting out in the waiting room, right? That they're in a secure data center and that you have cameras and other types of badge access to make sure that that access is only to people who truly need it. The last one is the technical controls. And in the next slide, we'll talk a little bit more about those. Yeah, the first technical safeguard we'll discuss is access and integrity. This is all about making sure that only the people who truly need EPHI or PHI in the course of their duties have access to it. So this is all about making sure your access rights line up with that. So not everybody who probably works at a covered entity requires access, and it should be denied by default. It's important not only to make sure that they don't have access, but that they can't modify it. And that's where the integrity piece comes in. The HIPAA legislation wants to make sure that our patient health records, they remain unaltered unless there's permission to do so. Audit, that one's all about monitoring to detect security incidents, but also make sure that the access controls that you've put into place are working. Authentication, the goal of the authentication safeguard is to make sure that nobody gets access to EPHI before they can prove that they are who they say they are. So we don't have shared user IDs. Everyone has their own login, and that multi-factor authentication really is implemented everywhere. That's one of the major authentication pieces, not specifically called out in the legislation, but from an implementation standpoint, multi-factor authentication, definitely the way you want to go. Transmission security. This one's all about making sure that patient health records are not transmitted across networks in an unencrypted format. And why that's important is pretty self-explanatory. The last one, it's not technically a technical safeguard. It falls more into the administrative bucket, but backups. It definitely has a technical control. And the goal there is to make sure that patient health records are not destroyed. So even in the case of an adverse event, that there is a copy that can be accessible both by the patient and the clinician. Pretty self-explanatory there. So what are the challenges for HIPAA when it comes to implementation? The first one I'd say is flexible requirements. Although the 2003 editions of the privacy and the safeguard rules, they did make it less generic. The requirements there are designed to be applicable to all different covered entities of all shapes, all sizes, running all different types of technologies. So what that leads to is subjectivity. They're never going to tell you exactly what you need to do. So often implementers are left questioning, am I actually abiding by this technical safeguard? Am I in compliance or not? Two is lack of resources. And this is especially key for small and medium-sized covered entities. The administrative controls that we spoke about, they take up enough time as it is. And then dealing with the physical and the technical safeguards, it can really, really be a challenge for a lot of organizations. 3 is monitoring. The IT systems for covered entities, they've never been larger, they've never been more complex, and monitoring those 24/7 to detect any security events, to make sure that all of your controls are working, that can definitely be a challenge. And the last one is potential audits. The audits, as we were discussing, they now have some pretty significant teeth to them. They can involve jail time for the worst offenses, but those are only ones where the offense was it was planned, right? Where there was a motive behind it. But potential audits can really be a pain. They can involve fines, and they're costly. So here's a little bit more about those audits. As we were mentioning, they are conducted by the Office of Civil Rights, that bureau under HHS. There is no specific frequency on audits, and the reality is that most covered entities will go the entire lifespan of their business without having one. But when they do get conducted, they are thorough. They can take weeks in order to complete one by the OCR. And when the process kicks off, they do happen quite rapidly. Covered entities only have 10 days to respond to the initial request, and then 10 days to respond to any subsequent follow-ups for information. And the likely triggers, although they can be random, OCR doesn't have nearly enough auditors to do random audits on even a small percentage of covered entities. So they're usually triggered by one of two things: either complaints from patients about their belief that their health records were misused or mishandled or breached, or incidents, the breach notifications that covered entities are required to submit. But here's the good news, is that when you have the right technology, a lot of HIPAA implementation gets a whole lot easier. And Field Effects MDR is really well positioned for this because we have holistic coverage. We stop incidents really, really early in the life cycle of them. And if you prevent incidents, you prevent breaches. You prevent breaches, you prevent breach notifications. And if you prevent breach notifications, well, we can prevent those audits, and nobody wants those. But more than that, more than just stopping malware in its tracks, what we're going to see in the next slide is that our MDR service is constantly feeding back useful tidbits to both covered entities and their business associates about how the risk can be reduced in that environment. We'll talk a little bit about data sovereignty, how we're a little different than a lot of our competitors in this regard. And lastly, we'll talk about log retention and what Field Effect and our MDR service can do for HIPAA and log retention. So first, holistic security. What I mean by that is that we have really sophisticated software, our agent that runs on the endpoint. It can detect malware there, but we're also doing deep packet network inspection for customers that have a Field Effect appliance at their gateway, inspecting all of the traffic that goes to the internet and is coming in from the internet. And the other things we're doing is monitoring all the cloud resources. So we have integrations with Microsoft Office, Microsoft 365, Azure, Google, and a whole bunch of other cloud providers, so we can monitor those. We also have our DNS firewall, which comes standard as in our complete package. And so with all of these components working together seamlessly, because we own and configure our entire tech stack, it really provides that seamless coverage, which is so important for HIPAA. Just to talk a little bit more about network monitoring. A lot of people think network monitoring's dead. I don't believe that. I believe it's still a very, very valuable part of network security, of cybersecurity monitoring, especially in healthcare settings. And the reason is because so many devices in a typical healthcare setting can't run endpoint security software. So think about your printers, the security cameras. They likely have an IP address, could be on your network, can't run endpoint software. Patient health monitors, very sophisticated, very specialized hardware, can't run endpoint software. And lastly, even some of the Windows servers that control diagnostic equipment, such as X-ray machines, MRI machines, these often come from the manufacturer with explicit instructions that they can't be modified, that they can't be upgraded to the latest operating system, that you can't add or subtract any software on there. So what to do? This is where network monitoring really comes in handy, because we can still tell you that, hey, we noticed an IP address on your network talking out to an IP address that's associated with cybercrime. You need to take a look at this immediately and likely take the device off your network or do further investigation. Our network monitoring is constantly loaded with the latest threat intelligence, so you don't have to worry about that. We take care of the analysis piece and the reporting piece, automated, all behind the scenes. Incident prevention. So what I mean that we can stop malware dead in its tracks, there's a couple of ways that we can do that. The first one is on-host blocking. That's through that sophisticated endpoint agent I was talking about. We have a ton of heuristic signatures in there that deal with all of the latest threats. I think the best example I can give to you is malicious documents. So if our agent detects that somebody's opened up a malicious Office document and it's trying to spawn malware, we'll stop it. And you'll get the blocking notification right on screen, along with a subsequent report. We can do host isolation. So if the compromise has progressed a little further, there's actually malware installed on the box, maybe we detect somebody's trying to move laterally on the network, we can shut down the box immediately so that we keep that compromise a small, very localized event before it escalates to a breach and it has minor impact on the clinic's EPHI. The DNS firewall I was talking about, again, that's loaded by us with the latest threat intelligence. You don't have to worry about any of that. And not only does it stop the end users on a network from reaching out to known malicious websites and blocking known malicious malware comms channels, but our customers can also enable content blocks. So they can stop end users from accessing content which isn't appropriate for a clinical environment. And that will help covered entities with implementing their acceptable use of assets policy. Cloud account locks, very much like we can lock down a host if we detect malware on it. If we detect one of your cloud accounts that is acting in a suspicious manner, we can lock that account immediately. Again, so that we can stop this before it has any serious impact on the clinic. And the last one is email rule deletion. Oftentimes when a threat actor will log into a cloud service, they'll create a malicious email rule. And a good example of that would be forwarding any email message that the inbox receives that has payment items in it, billing to an external email address. And the idea there is that the hacker wants to facilitate a business email compromise, find out a little bit more about how their victim does business, and hopefully insert themselves in that chain. We can delete those rules so that we stop that malicious activity. Here's a slide about how we do risk reduction, and I'll talk a little bit about why this is so important with HIPAA. The first one you'll see is a report that would come to one of our customers about unencrypted credentials detected. So what we're detecting here is the use of FTP, which is a legacy protocol, often unencrypted. In fact, most of the time, it's still unencrypted. And it's not the type of thing that you would want to transmit PHI over. So I think one of the biggest fears that people have with this compliance framework is that, one, they're going to be audited, and two, that the auditors are going to find something that they didn't even know about. And so what our system does, in addition to preventing security incidents is that we're letting you know how you can improve your environment on a 24/7, 365 basis. So think of it as COVID, field effect MDR doing a light audit all the time on that environment. The next ARO on here is about remote desktop. It could be completely legitimate here, but remote desktop, as I'm sure you're all aware, is often abused by threat actors, and it definitely poses a threat to the customer in this case. So we want them to know about it. Data sovereignty. So when I'm talking about data sovereignty, it comes back to that network appliance, the appliance that goes at the gateway that does the network inspection. But it not only does that, it keeps the vast majority of the data that we collect on a network, on the network, on premises. That's important for two reasons. One, there's legitimate uses to the cloud, but we're a little bit different than most of our competitors in that we don't by default suck everything up to the cloud. Our technology, we've found a way to bring the analytics to the data, so we don't have to bring the data to the analytics. And so I think this gives covered entities and their business associates peace of mind of knowing exactly where the data for that customer resides. The other thing that this allows us to do is to detect malware and threats more quickly. Over on the left-hand side of your screen, you see the results from the MITRE evaluation that we participated in this spring, where we came second only to CrowdStrike in mean time to detect, which means that this philosophy is allowing us to detect threats to our customers quicker than a lot of our larger competitors, people like Microsoft, SentinelOne, some of the heavyweights of the industry. So it's twofold there. We're giving you peace of mind while also speeding time to detection of threats. The last thing I just wanted to mention briefly was log retention. I know a lot of covered entities have been led to believe that in order to meet the 6-year log requirements of HIPAA, that they need to implement a full-scale SIEM solution. SIEM solutions, for those of you who are not aware of, are very expensive. They take a lot of time to tune. They take a lot of upkeep, and they really don't provide a lot of cybersecurity because you're constantly behind the 8 ball. The SIEM solution is only reporting on things that have already occurred. So you're constantly trying to catch up to the threat. So with our, we can help with log retention. We do it as long as you want, up to 6 years. And one of the great things about that appliance on the network is that it can also be configured as a syslog receiver. Syslog is a very common format for logging. A lot of systems produce syslog, and we can receive it in the appliance, bring it up to the cloud for long-term retention and storage. And we can do that at a price that is very, very inexpensive compared to a full-fledged SIEM solution. So our MDR can be part of that whole log retention solution for a covered entity. Last thing I just wanted to talk about is audit support. As a partner, as a customer of Field Effect, I don't think it's ever happened, but if any of our healthcare customers was to ever get selected by the Office of Civil Rights for a HIPAA audit, I can assure you it would be all hands on deck here. We are always happy to jump in and help our customers when they get audited. And that means answering any questions they have, jumping on calls with the auditors if that's required, helping with the evidence production. We're here to support you guys in any way necessary. And that's not just for HIPAA. If it's a financial audit, anything like that, please get in touch with our customer success team so we can facilitate that. All right, I know I've thrown a lot at you in the last 25, 30 minutes, but if you have any questions, I'd be happy to go over them right now.
Okay, lots of questions. So thank you. What if you have 1,000 people who can access while on their own laptop at a person's home? would you say they need to be monitored? So I'm thinking that's maybe like a home care situation where they're like using their personal devices to access.
Yeah, well, the use of personal devices, that brings up a host of issues with PHI because once the person's downloaded it to their personal device, it's kind of outside your control. So they could get hacked and you might not even know you have to submit a breach notification. So I would say BYOD and HIPAA, they do not align really well.
When it comes to incident prevention, what about malware that then changes to ransomware once clicked or open? Can feel
Yeah,
defense that.
yeah. So that's a big problem. Ransomware is out there, and yeah, we stop ransomware as well on a daily basis on our customers' networks, and it's through that holistic manner, right?
Where does field effects threat intelligence come from? Is it field effect tools collecting, or do we subscribe to an open source tool?
Oh yeah, that's a great question. It is a mix. We have a bunch of open source threat feeds that we are taking in and aggregating, but we also have our own feeds. So, and that's through our investigations and also through the incident response activities that we do. So if we see a new indicator of compromise on one of our customer base, and then let's say our analyst Googles it, sees it's unique, then we can put out the indicators to all of our customers rapidly.
We're going to be talking about July 19th here.
July 19th, okay.
Yeah, as I'm pretty sure this issue is top of mind for CISOs, among many others in the healthcare industry. Is there
Yep.
anything Field Effect does beyond network monitoring, incident prevention, etc., to attain sufficient, with 2020 hindsight by regulators, I'm assuming to attain sufficient information to promptly address the recent CrowdStrike Microsoft outages?
Yeah, so the CrowdStrike outage, I think it's important just to talk a little bit about how our endpoint agent is different. One of the things that we built in from day one into our endpoint agent is that it has the ability, if worse came to worse, it can detect if it's blue screening the box. And so what would happen, even if something catastrophic was to get through our very, very rigorous testing process, that the box would blue screen a couple of times and then the agent would take itself out of the loop and then the box would proceed to boot normally. So worst case scenario, you wouldn't have the benefit of our endpoint protection, but you would still be able to go about your business while we resolve the problem. The other thing to keep in mind is that our company was founded, our CEO is one of the foremost experts in the world on kernel development in the Microsoft operating system. This is something he spent his entire adult life doing. So we're a little different in that regard. A lot of our competitors are run by very capable, but business and marketing guys. Ours is run by a kernel developer. So he takes this stuff extremely personally.
In Canada, is it correct to say that we don't need to follow HIPAA? We are using HIPAA and the Canadian baseline cybersecurity controls.
That's true. And in fact, we're going to be having a webinar coming up this fall on Pepita for our customers. Yeah, Canadian customers do not have to apply by HIPAA. I can think of some scenarios where they might be doing business with a US covered entity as a business associate and they fall under it. But by and large, yes, if you're a Canadian healthcare clinic, you have equally stringent protection compliance, but it's under our framework, not the American one.
If you have any more questions, please feel free to reach out to that let's chat at fieldeffect.com email address on the screen. Take a quick screen capture, write it down somewhere, and we're happy to answer any additional questions that you might have. So Matt, thank you so much for taking us through that content today. Incredibly helpful, incredibly useful information for those attending. And to our wonderful audience who took the time to stay to the end, thank you so much for joining us today.
Have a great day, everybody.